my name is Katrina Apostle. In this presentation, I'll be explaining the concept of request for information for an electronic health record vendor. In this scenario, we'll be looking at Cobra Valley Regional Medical Center. In 1910, the Miami Inspiration Hospital was founded by two organizations, Miami Copper Company and Inspiration Consolidated Copper Company, to accommodate for their employees' medical needs. Over the years, the patient load continued to grow, thus requiring a new modern-day hospital to better care for these patients. In 1966, a new hospital was built with new radiology, laboratory, and modern suites for surgeries, obstetrics, and emergencies. The hospital continued to expand and provide new services such as nuclear medicine, sonography, mammography, CAT scans, and MRIs. By 1992, the hospital was renamed Cobra Valley Community Hospital when Brim Healthcare Management assumed the administrative position and the hospital's relationship with the mining companies were severed. Consequently, approximately $9,300,000 was later invested to continue expanding and modernizing the hospital's facilities. Today, the hospital is known as Cobra Valley Regional Medical Center to better reflect the population that it serves. It is a 25-bed facility that now provides services including orthopedics, outpatient surgery, cardiology, general surgery, OBGYN, infusion center, physical therapy, podiatry, telemedicine, wound clinic, pediatrics, cancer center, radiation oncology, primary care, pharmacy, diagnostic imaging, laboratory, and hospital units such as ED, Med-Surg, ICU, OB, and observation. This facility is still utilizing Meditech, an older and outdated electronic health record, or EHR, with limited features, lack of user interface, and problems with system updates. A survey called the Black Book Rankings asked 17,000 practices why an organization may decide to switch from one EHR system to another. The findings show that the three main reasons for EHR transitions were 1. Incompatibility with the practice's needs, with 80% of users' votes, 2. Poor usability, with 44% of users' votes, and 3. Poor interoperability, with 20% of users' votes. If the facility continues to expand, an EHR like Epic would be more beneficial as it provides advanced tools, including but not limited to AI-powered analytics, patient involvement features, and telehealth abilities. Second, Epic gives a good user experience because it provides a user-friendly interface and customization options that can also be helpful for potential increasing scalability. Evidently, Epic received 5 stars for user experience from 50% of users, whereas Meditech only received 5 stars from 15% of users. Third, Meditech has been reported to experience problems after an update, thus negatively affecting user experience. For these reasons, the facility would greatly benefit from a new system, specifically Epic, to help with future expansions and delivering high-quality patient care. In fact, KLAS, a healthcare research company, gave Epic an A for performance in market share overview in 2023, whereas Meditech only received a B. A request for information, or RFI, is defined as a formal process for gathering information from potential suppliers of a good or a service. This would be the first step in a procurement, otherwise known as a process in which a good or service is purchased for a business. The purpose of an RFI is to gather preliminary information about a product from a variety of different vendors to help quickly compare and narrow down potential vendors. RFIs should include sections for company information, overview, requested information, and a response. Basic information such as the company's name and contact information, project name, etc. should be included in the company information section. The overview section should provide a summary of the company and explain the purpose for which the RFI was sent. The requested information section should include questions regarding the product, such as the cost, features, security measures, ongoing support, timeline for implementation, etc. Lastly, the response section should include evaluation criteria, how to respond, and the due date for which to respond. It should also include a template for the vendor to easily fill out and send back. Utilizing an RFI is advantageous in selecting an adequate vendor because it allows organizations to collect information and make an informed decision prior to making the selection. Vendor evaluation and rating scales can also provide a standardized method to compare vendors and help make the decision. In fact, the ONC provides a template online to assist organizations in evaluating EHR vendors, while KLAS Research provides a rating scale for EHRs. Epic is a cloud-based system that is utilized in many practices ranging from community hospitals, inpatient care, primary care, multi-specialty hospitals, independent practices, dental practices, and hospices. Epic systems have a variety of software modules such as Epic Care Ambulatory and Epic Radiant that are customizable to support the unique needs of a specific practice. Epic has also developed and integrated its own cache database to simplify the database administrator, or DBA, process and facilitate faster KBSQL access. Collaborating with intersystems and utilizing cache databases provides robust tools like 1. Security measures or features that are Common Criteria Evaluation Assurance Level or EAL3 certified. 2. Data mirroring. 3. Embedded operational analytics tools. 4. Multi-model architecture. And 5. Cross-platform architecture. First, the cache database provides security measures such as encryption, security auditing, and tools for smart authorization. It ensures that the common criteria guideline for IT product security are met. Second, data mirroring is a cost-efficient process where data is replicated in real time and stored in backup devices to aid in data parity and data recovery. Third, there are tools that allows DBAs to efficiently analyze key performance indicators and improve productivity. Fourth, the cache database can support a variety of datasets, thus allowing easy access to items like documents and tables. Fifth, the cache database's cross-platform architecture allows easy access from a variety of different platforms such as Windows and OS X. Overall, these features enable 1. Reliability and agility in business, and 2. Supports care coordination, interoperability, and electronic quality measures in healthcare. Epic is one of the most used EHR systems in the United States, with approximately 305 million people having a medical record within the Epic EHR. In fact, Epic has been recognized and awarded in several areas. According to the U.S. News and World Report, 40,000 physicians and 5,000 hospitals were surveyed. The results found that Epic was utilized in the majority of America's highly ranked hospitals. It was used in 22 out of 22 of the best hospitals, 8 out of 10 of the best pediatric hospitals, 18 out of 22 of the best primary care medical schools, and 20 out of 20 of the best research medical schools. Furthermore, Epic was utilized in 82% of healthcare information and management systems, or HIMSS, Stage 7 clinics, 79% of HIMSS Stage 7 beds, and 65% of HIMSS Stage 7 global hospitals. HIMSS Stage 7 is the highest recognition achievable for health information and management systems, so having the majority of HIMSS Stage 7 facilities utilize Epic is an accomplishment. In fact, 62% of HIMSS Davis Awards of Excellence winners are part of the Epic community. These awards recognize facilities that have adequately used the EHR systems to successfully improve patient outcomes and increase return on profit. Lastly, the top 15 recipients of the National Institute of Health, or NIH, research funds were also part of the Epic community. Although the prior data has made it evident that Epic has supported care coordination, interoperability, and electronic quality measures, another example for care coordination support includes the integration for artificial intelligence, or AI, within the EHR. AI tools, including predictive analytics, are embedded into clinical workflows to illustrate potential patient results, recommended treatment plans, and assist in making medical decisions. Accessibility to AI tools ensures that 1. Patient-centered care is maintained, 2. The process is simplified for users, and 3. Data accuracy is improved. Other examples where Epic has supported interoperability includes its cloud-based system. Its design allows users access as long as the device has an internet browser. This also facilitates patient involvement because they can easily access their medical information online through the patient portal. As mentioned in the previous slide, 62% of HIMSS Davis Awards of Excellence winners are part of the Epic community. This shows that Epic has supported the meaningful use of EHRs within its physicians. Another example where Epic has supported electronic quality measures includes the Quality Measure Details report function, which shows detailed information about a specific electronic clinical quality measure. It allows staff to analyze healthcare quality and make appropriate changes if necessary. When implementing Epic, the vendor provides support services such as technical support from advising Epic experts, self-service tutorials, and developer forums. These tools will aid stakeholders in any troubleshoot issues they may encounter during the transitional period. Epic experts can be contacted for guidance and assistance. Self-service tutorials are available online for those who want to teach themselves or have a resource to refer back to later. Lastly, developer forums are also available if users would like to review peer experiences and encounters for a peer-to-peer learning experience. The vendor also offers several forms of system training for stakeholders, including role-based Epic training, super user Epic training, and process-based Epic training. Role-based training is a delivery of system training from expert to user in an environment that caters to users' needs and roles in the organization. Key information is taught to users and questions are answered during the session. Super user training is the delivery of system training to a group of selected users. These users will then be trained to become experts on the EHR and act as additional resources to the organization during the transitional period. Lastly, process-based training is a delivery of system training from expert to user with emphasis and priority on the facility's workflow, rather than the user's role in an organization. Epic is a sufficient candidate to replace the current EHR system at Cobra Valley Regional Medical Center. It can support the organization's needs, whether it be a small community hospital or a large multi-specialty hospital. The software modules are customizable to fit the requirements of the facility. Epic's cache database also offers a variety of robust tools to aid in both business endeavors and the overall quality of care. Research shows that Epic has been recognized as the most used EHR in top-ranking hospitals and HIMSS Stage 7 facilities. Lastly, the vendor provides adequate support and stakeholder education to help the facility through the transitional period. In conclusion, Epic EHR is recommended to promote quality of care at Cobra Valley Regional Medical Center.